Hello and good evening. Today is the 9th of December. My name is Dr. Diana Solana Sadende, and I am a student at the MPH program in Liberty University. And I'm going to spend a few minutes discussing with you and talking about my practicum experience where I got to promote monoclonal antibody treatments through stakeholder engagement and outreach efforts. So first of all, I want to say that we are fighting a COVID-19 pandemic. And so I hope everyone is practicing those public health measures. Wear your mask, wash your hands, keep a 6 feet distance, and take the vaccines. Now, what's going on is complementing the vaccines are what are called the COVID-19 monoclonal antibodies. These are infusions that are given to high-risk eligible individuals who test positive and present with symptoms, mild to moderate symptoms, okay, within 3 to 10 days. There's a list of eligibility criteria that the EUA for these monoclonal antibodies show. So please feel free to visit that for more information. It's on the FDA website. And again, we can just Google it. Anyway, so the public health problem, right, that actually led to this, practicum experience, which was a great opportunity for me to learn more about what happens on the field, had to do with the lack of awareness of this COVID-19 monoclonal antibody treatments in the underserved, vulnerable communities and people identified with unmet needs, because there was a major impact, especially with the African American Black minority group. As of September 9th, 2021, there was a report that came out by CDC, and they found that this specific group had 1.1 times more cases, 2.8 times more hospitalizations, and 2 times more deaths than white, non-Hispanic, racial ethnic groups. And so, when you think about health equity, we're like, hey, not only are we going to promote to the African American groups, we need to also promote to the Asian groups, to the Hispanic groups, and to the Native American and Alaskan groups, right? So the solution to this public health problem of the lack of awareness of the COVID-19 monoclonal antibodies was now to increase the awareness of the COVID-19 monoclonal antibodies through outreach efforts and stakeholder engagements that can possibly lead to an increased use of these mAbs when the high-risk populations do get, positive with COVID-19 and have to be treated right away so that they can avoid being hospitalized and dying from COVID-19. And so here I'm just showing you a photo, a schema of a summary of the COVID-19 agents that we have out there. So prior to illness, the vaccines. We do encourage everybody, please do take your vaccines, especially with the variants that are going on out there. In addition to that, when you do get exposed and you do present with mild or moderate symptoms, immediately present to an infusion center so that you can get the monoclonal antibody treatments. This is what ex-President Trump received within a few days of finding out that he was COVID-19 positive. And then it was the Regeneron that he got. And he got better. So the side effects are negligible as well. We haven't had a lot of reported cases of side effects. Yet again, people do not know about this wonderful product or therapeutics, the monoclonal antibodies. And so we need to keep pushing it out and pushing it out so that the public knows about it. And again, it is procured by the United States federal government that have been gracious to provide these therapeutics for free. And so all these medications can be taken to prevent hospitalization and even going into the ICU and then possibly dying from COVID-19. Next slide. And so now the main objective of my practicum was to augment outreach efforts and to increase awareness of mAb treatments among these target population. And again, the target population are who? They're the high-risk and eligible individuals who test positive for COVID-19 and do exhibit onset of symptoms within 3 to 10 days. And so the goal was to engage with several stakeholders, healthcare providers, frontline essential workers, federal partners, and the general public, anybody that knew about anybody getting positive. And as long as they're being educated on this, they can provide the information to the individuals that test positive so that we can reduce hospitalization rates and death rates in the United States. And so these efforts will lead, hopefully, to increasing the use of mAbs in at least more than 20% of the target population. And the goal was going to align with it was going to align with the White House administration mission. And I just want to say that under the Biden-Harris administration, the COVID-19 Health Equity Task Force was created. And what they were supposed to do, their mission was to ramp up testing and contact tracing and promote treatments needed in the underserved, vulnerable, and target communities that were heavily impacted by COVID-19. In addition to that, in March 17, 2021, the Biden-Harris administration announced $150 million budget to aim at expanding and increasing access of COVID-19 mAb treatments in these communities. So as you see, the federal government has taken a big stance to make sure that equity does occur in all groups. And so the methods that were used, right, had to be approved by the agency. The methods I had to use, to promote these outreach efforts had to be approved by the agency. We had an outreach strategic plan in 4 pillars that had to be approved. And the strategies that were taken included developing a master stakeholder list, sending interest emails to these identified stakeholders, and this actually served as a pilot study, just to get a survey of who knew about mAbs and where we really needed to promote, which group of people did we need to promote mAbs to. Another strategy included drafting and publishing resourceful materials, presentation slide decks, communication tools, especially for social media content, just to keep promoting mAbs, and also organizing live presentations, webinar roadshows, and conducting outreach events such as the town hall meetings and other meetings, one-on-one meetings with key stakeholder parties. And it was important to know that throughout the practicum, maintaining stakeholder engagement was a key component to promoting COVID-19 mAb treatments. So results from the pilot study showed that more than 61% of the stakeholders who got to get this interest emails were like, hey, what are these mAbs? What can you tell us more about it? We don't know about this. How can we find out? Because some of them even were like, we'd like to request for live presentations and we have other questions. So the majority of the stakeholders who received the interest emails were very interested in knowing more about the mAbs. And that showed that there was really a lack of knowledge about the monoclonal antibodies. And then in lieu of that, it led to the drafting of fact sheets and resources that we had to work with, had to work with contractors to make sure that we had enough information out there about the mAbs that healthcare providers could use when advising their patients or individuals or trying to promote mAbs. Also, the digital toolkit did come out, and that included content that could be placed on Twitter accounts, Facebook accounts, so that stakeholders could use that to continue to promote mAbs. And then, of course, after the live events and webinars, if folks needed more information, then we'll give the FAQ documents that would actually list more like a cheat sheet of all the kinds of questions you could have about mAbs and the answers that were assigned with those. And so I do want to say that during this practicum, I had a great experience. I wish it could have lasted longer, even permanently, because, I felt like I was really, doing a lot, making an impact in the world, saving lives, talking to a lot of people. I talked to somebody, a clergyman, and he got positive. And when he heard about mAbs and I was able to educate him on it, he took the mAbs and then he actually told his congregation about it. And so that just continued to promote the mAbs, created more awareness, and finding out that, one of the lessons was word by mouth does work. It makes a big difference, and people just need more education and awareness, of what's going on to reduce the stigma that they have with COVID. And what I'll do differently is do more in-person contacts rather than virtually, because, you can't do everything over Zoom or MS Teams, but then having that one-on-one engagement, again, through word of mouth, that's one way you want to advocate anywhere and to anyone, just to increase the awareness of mAbs. And I just want to lastly say that the work continues. The journey of 1,000 miles begins with one step. However, we need to continue to advocate and promote COVID-19 mAbs. I have provided here some information, some websites you can go to for additional information. And I do want to say all this could not have happened if not for teamwork and the opportunity to do this. So thank you to my practicum preceptor, my practicum instructor for always being there, and the federal COVID-19 response team. All this together, we work together collaboratively to promote mAbs. Thank you. Bye-bye.